Greetings, my name is Symphony Roja Charles, student ID 0512500051. We'll be presenting on the pillar of trust, ethics and confidentiality, guidelines for new practitioners. These are the roadmaps of our presentation, and we have 8 topics to go through. So let's go on. The first is the introduction to professional ethics, the foundation role of APA ethics code, which serves as essential guide for clinical practice and professional integrity. There are 3 main parts, which are core trust, ethics, and privacy. Core trust, as in you have to gain the trust of your clients. That is an invaluable asset of the psychologists. Second, we have ethics, moral principles, that governs the professional behavior of this psychologist towards the client. Then we have privacy, which is the right to be left alone and duty to protect the data of your clients. Moving on to APA standards governing confidentiality. Confidentiality is another important part of ethics, ethical framework, privacy, and confidential overview. The first one, standard 4.01, which is mandates maintaining confidentiality as a primary obligation of the practitioner to protect clients' privacy. As I said, private clients' privacy is the main essence of the psychologist. So it's important to maintain the confidentiality. The second one, standard 4.02, practitioners must discuss the limits of confidentiality with the clients. Okay, what is the limit from beyond when to when this confidentiality is carried on, and also ensure the informed consent regarding data disclosure. How much of that data is being will be exposed or will be retained for the privacy of the clients. If the clients allows the certain level of it, then level of being exposure, then it is up to the clients to decide as well. Then there's also the conduct balance, balancing legal requirements with ethical aspiration, an important way of maintaining professional conduct and pillar of trust. Now, this is a balanced way of where it involves the law and the amount of data that the psychologist is required to share, but in the law, according to the law, and also the amount that the client is allowing. So there should be a balanced conduct. It's in a discussion between the psychologist and also the client to come to a proper conclusion. Moving on, we have the burden of protection. Now, what is the burden of the protection? We have 4 points, which is power balance, so ethical duty of care due to clinical imbalance. Then we have data security. Clients cannot manage the security of clinical data. Clinical data is beyond what the client is able to control. Then we have the gatekeeper, psychologist as a guardian of sensitive information. So of course, the client is trusting you to keep their information, their deepest, darkest secret, a secret, a secret. So there's no revealing. So that's the gatekeeper. Then we have legal liability. Liability is assuming professional liability and ethical duty of care. It involves assuming professional liability. Then there's also the ethical way of taking care of your client's interests. Now we have ethics and trust. Informed consent, which is beyond a signature. It's not just a basic signature on a piece of paper, black and white to get it legal. But it's beyond that. So it's a clear confidentiality, which is establishing privacy terms early, using accessible language to explain legal requirements. Instead of using tough jargons or words that clients do not understand, use a basic common language where the clients will know what they're getting into and what they're agreeing to before they sign the consent form. Then we have the accessible language, translate complex ethical jargons into understandable. For instance, your clients are not always well versed of all psychological terms or the high level of English or maybe whatever language you're using to communicate to them. So you bring it to a basic communication level to them so that they will understand what they are required to do and what is about to happen around them during that session. Then also this true understanding, verify actual client comprehension rather than just collecting a formal signature. Ask them to go through every rules given there in the consent form one by one. If there's 10 points, ask them to go through all 10 points. If they do not understand, ask them to give them the room to ask questions instead of being judgmental or being looking down on them. Give them the comfortability to understand what they're actually going through and help them to understand what is the rules they are supposed to follow. The ongoing process, the treat consent as a continuous dialogue maintained throughout the entire treatment. Now, this consent form is not something that the first session you get a signature from them and then the proceeding sessions you stop asking the consent. No, every session has to have a consent form, so they have to understand. So it has to be a repeated process where they will understand every session as the same rule goes through. Okay, there are limits of confidentiality, which is silence must be broken. There are four issues here. Mandatory reporting, reporting of abuse of children, adults, dependent adults. It requires mandatory legal notification. For example, informing the police when there's an abuse case is involved, where the parent, if it's a child, the parent is being involved here. That is a mandatory reporting. Then duty to warn, imminent threats to self or others. For example, the person is having suicidal thoughts. So it is the psychologist's duty to warn the involved party. If it's a child, inform the parent. If it's an adult, uh, inform to the dependent, to the people who are dependent to them or their guardian. Then we have the APA standards 4.05, which is disclosures permitted when required by law or for valid professional purpose. For instance, if there's a case of murder and the party who is involved in the murder is actually involved with a counseling session, the counselor is required to submit a certain part of documentations, legal documentations, to the investigating parties. So it's a necessary. And we have minimum necessary, which is only essential data should be shared to protect client privacy during disclosure. Of course, there's also not all the information is disclosed, but a necessary amount, as in if it involves a certain case, it will be disclosed. Okay, there's a case study, Counselor's Dilemma, the Pillar of Trust, Ethics and Confidentiality. We have the scenario 1, step 0.1, which is policy clash. Full session notes for a field trip via blanket policy. Then there's the standard where school policies versus ASCA standards, as in analyzing the ethical boundaries, that is ethical conflict. Then we have the risk analysis, which is the assessment, privacy erosion by vetting administrations. Ethical resolution and student advocacy. We have the advocacy strategy, which is privacy versus safety equilibrium. Okay, it advocates for students' rights by negotiating minimum necessary, as I said earlier, minimum necessary, as in not the entire client session is being discussed, but however, a chosen part is discussed. It protects the clinical integrity by providing fitness for duty summaries instead of disclosing raw session notes to administrative bodies. So the psychiatrist will produce a report which is for summary, which is a fitness for duty summaries, a summary that is related to the topic that is required for the individual. So it's 100% confidentiality rate with minimum necessary data and pro student rights. Okay, the conflict resolution is APA standards 1.03, navigating ethics versus original demands. Finally, we have come to the summary, best practice for confidential therapies, which is documentation. Number one, the most important documentation. Always document the informed consent process throughout the session. It's not just one session. If there are 5, 6 sessions, every single session should have a documentation of the informed consent. Okay, it is to ensure the integrity of the psychologist. Then we have the consultation. Consult with peers or legal counsel when facing a complex ethical gray area. If the situation or the area is too new for the practitioner or for yourself, consult to a senior peer who have maybe has experience, that who have heard from someone with experience, to get a better idea about it. And third, we have safety and autonomy. Prioritize client autonomy while maintaining public safety through transparency. Now, the transparency to the client, as I have said, clients are aware of what their rights is and what they're supposed to do, what they're not supposed to do. So this is a way of being a best practitioner of therapies. That is all from me. Thank you.